What's going on, everybody? This is Andrew Lee, your admin over at the California Insurance Agents Group, and also the CEO of Health Mutual Network. And I am joined by George Beach, and George is a kindred spirit in terms of what we do here at my agency. He is a Cover California savant. I don't know really anybody else. That's why I have him on. I don't really know anybody else that is. If you guys are, please comment below because we want to meet you. We want to find out and trade notes. But George has always sort of been a reliable kind of accountability buddy when it comes to everything going on with Cover California. So he's sort of like my go-to. We like to have good chats here and there. Even when I first started, he gives out good tips, and he's always been helpful, and that's just George. So George, I welcome you to the podcast. So glad that we're here,
Thank you,
and
sir.
what we're gonna do is we're gonna just do a deep dive on Cover California, and we're gonna go into specifics. We're gonna nerd out, and if you guys sort of get lost along the way, it is just what it is. But for those that are, sort of like intermediate, going into the advanced stages of Cover California, this might be for you, and maybe even beginners if you guys, have just the know-how to just learn things pretty easily. So, George, how's everything with you, and how's business?
Everything's good. It's finally slowing down, which I know sounds funny to talk about that, but we go crazy starting in October because that's when we can start renewing covered California clients, and we just close. Well, we don't. We've got 2 more days still
Yeah,
for a February 1st effective date for covered California. But I took a vacation the last week of January, battling a cold, battling a second cold, and so I kind of just said, you know what, I'm going to slow down finally and enjoy it. But yeah, things were really good. New carriers came in to NorCal, lost a carrier, so had to do some changes and stuff. So yeah.
yeah. I mean, which carriers are you talking about?
So for Northern California, Aetna CVS came in for a couple of the Sacramento area counties, and then we lost Bright Health. So they came in for 2023. Um, they wooed us, and then they left us.
Mm.
Luckily, they were only in one county as a test run. But yeah, they thought they were an insure tech coming in to try to change things, but it didn't really happen.
Well, they got bought out, didn't they?
Well, their Medicare side did, but their
Oh,
ACA side, I think, kind of flopped.
flipped
So
around. Okay.
yeah.
I mean, there's a couple carriers like that, but that's cool. Okay, so yeah, Aetna CVS, of course, that's available down in SoCal as well too. So I think that's statewide. Guys, just for the record, I'm in SoCal, Georgia's in NorCal, so you're gonna get both perspectives on this. Um, So, yeah, I mean, again, just on that topic, I mean, we're gonna go into other topics, but just on that topic, yeah, of course, there's gonna be Oscar that just left in Southern California.
That's right.
And Oscar was my best friend when when I first started, Oscar was like a good carrier. They were known for customer service. They were known for their willingness to help. They were known for, you know, their app, their technology just being sort of top of line, right? And then all of a sudden, I don't know what happened. I think they started making, I think after the pandemic something happened, some layoffs or whatever the case is. It
Mm.
just wasn't the same. Now Oscar's out. Now Oscar's out of the Cover California's exchange. They have pretty decent commissions too, so I was like, "Oh, I like Oscar." But they're out, and a new carrier in SoCal is IEHP, Inland Empire Health Plans. If you guys are in the Inland Empire, you know exactly what I'm talking about with IEHP. They have a pretty good network. Anybody that's sort of been, it's basically the Medi-Cal's health plan in the Inland Empire, so San Bernardino County, Riverside County. So that's a new carrier in town. Pretty solid so far from what I've heard and what I've seen. They're very new, of course. They don't have a star rating yet, so we'll see. But
Mm.
a lot of changes. So Yeah, that's George. I just want to get you on just because I wanted to again do some nerd talk with you about Cover California and make sure people are really just understanding the ebbs and flows of the networks and the specifics of how this all goes. So one big issue that we were just talking about was what's going on with the counties, man. What are they meddling in our Cover California portals?
Right. That's my one of my biggest gripes is Medi-Cal, which is our version of Medicaid for the state of California. They supersede Covered California when it comes to the system. So even if the client is not a Medi-Cal client, Covered California and Medi-Cal pull from the same database, Cal hears. Um, but Medi-Cal can go into any case file and see what's going on, and if they mess something up, we as brokers could end up getting locked out of the case because the county made a change, affected the income, which brought it down for some unknown reason. And then we have to tell our clients, sorry, the county got in there. You now need to spend your time and energy trying to get them to release you back to the covered California side.
And
And
it's
it
frustrating.
happens constantly.
That's all I've been dealing with in terms of customer service for the past 2 months,
Mhm.
and obviously, we don't get paid for Medi-Cal as well too, so we're losing business as well,
Yeah.
by that all happening, and there's so many other factors as to why that's happening, of course, because this is the county's gonna come in with Medi-Cal based off of income, obviously, and if they're right at the cusp of, qualifying for a
Mhm.
$0 Cover California plan or Medi-Cal, those people, if they were just barely at that limit, automatically go into Medi-Cal, and then you get calls. I mean, our office has just been going crazy. My admins are like, "Man, this is this is so repetitive." But, like,
Yeah.
they call in and then it's just like, "Oh, what do I do? I got charged my full amount." Right? Because the carriers, if you're set on auto pay, they just charge that full amount saying that you're on Medi-Cal, and then they just sort of leave it up to us to figure that part out. I've
Yeah.
been I've been getting a lot of that, and that's a nightmare scenarios, especially for people who are borderline Medi-Cal. That means they don't have any money. And then all of
Mhm.
a sudden they pay an $800 premium, it kills them.
Yeah.
We've been dealing with that too. I
Yeah.
don't know. Yeah.
I will say this, I don't mind taking those Medi-Cal applications if someone calls in, or I get a help on demand and it's for sure Medi-Cal because they have either no income or it's low income. I still take it. I will definitely put it into the covered California system because if and when they become ineligible for Medi-Cal, and if they self-select a health plan or if they call the Covered California Service Center and they get help with selecting that, we're still the broker of record. So we still get credit for that. We still get the commission once that happens.
That's true.
So I'll take them. I'll definitely put them in. But I have to tell them that once you're deemed Medi-Cal eligible, I have to be hands off. I can't access anything. I can't make changes to your application. I have to call the county and here's that county phone number and
Yeah, and then you have
good
to
luck.
yeah, grab a glass of wine,
Yeah,
is what I always tell my clients, you're gonna be on there for a little while, someone's gonna have a bad day at it is a county job at the end of the day, so you're gonna get people that are having a bad day. If it's the weekend, good luck, because 'cause they're on Friday mode, and, you
yeah,
just have to really find some and then they point fingers at each other, like, when there's just, like, do not wanna do their job, it's like, "You gotta call Cover California," it's like, "No, you gotta call Medi-Cal," it's like, "No, Medi-Cal, you need to involuntarily disenroll by
yeah,
showing your income that indeed your income is going to qualify you for Cover California, not necessarily cancel the policy because if you cancel Medi-Cal, then you're not going to get subsidies because you canceled it, right?
yeah.
If you get involuntarily kicked off by showing your income and proving your income, that in itself even takes like weeks. So it's
Oh
like
yeah.
frustrating for clients. So
Sometimes it's instant and it updates, and sometimes it doesn't update till the last day of the month. And
yeah. No remorse. And you know
yeah,
what? Again, it is just like the way that I mean, you and me both have, the service spirit, we're like helpful people, but then like we're just gonna be like, nah, man, we can't we can't do nothing about
yeah,
this. So the
yeah.
county really just wants to overturn this. So I mean, and also the county will meddle with, they'll give them the wrong information sometimes.
Hmm.
And then all of a sudden, you're going down this like rabbit hole. And again, this is not conducive to, you know, sales. This is not conducive to your selling time, money generating activities.
Yeah.
This is all just taken away from that. So I understand our frustration, like with all this happening, So
Hmm.
a solution, I mean, the best solution I got, and George, I mean, you can go next on, how you do it, but I mean, the best solution I got is, again, I just train my clients and I just be very straight up with them. I've had clients where it's like, Andrew, like, please call for me, like, or like, I got people that get aggressive. Like, Andrew, you better call this. You're my agent. You better call them and you better get this done. Uh, but I'm,
Yeah.
but I'm not your caseworker, right? And so
Yes.
you really have to really tell them that and then just be really serious with them. Like, dude, I'm a broker. Dude, like, this is the county. So, you really have to train your clients and just make sure that they're involuntarily disenrolled, kicked off of Medi-Cal so they can get subsidies again. So that's sort of the solution. I mean, it's not an easy solution. There's not a shortcut to this. It is just what it is. But, I've had, hundreds of clients that, took my advice and got back on. So,
Yeah. Oh, no, it's definitely doable. Especially if they have the income to prove that they're not Medi-Cal eligible. Um, I've got one client that for some reason every year it seems like they get pushed over. I'm like, how did it happen again? Like,
dude, do a yard sale, man. Do a yard sale and make it
yeah,
up.
yeah.
Make up the rest of the money, man.
What are you projecting your income to be? You're
Yeah.
gonna go. You're gonna go work for Uber. Great. Let's
Yeah.
put that in there.
Yes. Yeah, like anything taxable. Like
Yeah,
keep working on those scratchers. Like you
yeah.
win the lottery, something, like whatever you have to do. But so that's annoying. But what sort of your solution that you tell your clients if that's the scenario?
Um, I tell them not to. I know that sounds bad. I don't touch your account. Like, if you need something done, if you have changes, reach out to me. Let me do it for you. Because if you accidentally check the wrong box, or if you mess up the income and it sends it to Medi-Cal, it's going to send it instantly. There was a time period where um the Medi-Cal info wasn't sent until like 8 o'clock at night. So if they went in and made a change and it said Medi-Cal eligible, we still had a chance to go in and correct it. Nowadays it's instant. So to save them the trouble, I tell them, call me, let me know what's going on. I'll make the changes. Because I've seen it where someone checks the wrong box or they uncheck something because they don't understand it. Um, and it messes it up. And sometimes you can get it corrected and sometimes you can't, especially when it goes to the county. And then you're like, I can't touch it. You got to do it now yourself. So,
Right. And yeah, and just me like wanting to just get this done for them and then just that whole like just it just wastes so much time. So, I mean, I get it. Like I do my best to preemptively warn them, like, I send out a bunch of emails like, "Hey, if you're this is the FPL chart, take a look at where you're at. Remember
yeah.
what we talked about, what your projection was. Are you here? Are you there?" So I'll do like an email. I'll blast that out. Just like, listen, this is what's gonna happen if you don't. Of course, a lot of people, sort of just, it goes to spam or whatever it is. But I try to do my best to sort of set them up so they don't get into that situation. Because then again, they're talking about their family, their livelihood. I had a PPO plan. Now I'm on Medi-Cal. What's going on? Like, all that kind of stuff. So
Yeah.
that's sort of what's been happening. Now, like going into the topic of clients sort of messing up their own apps. I mean, I've seen a share of this. I mean, this is of course. I mean, if they call in to cover California, I mean, of course, you're agent of record, so it's not like they're gonna go in and steal your business or anything like that. But
Mm,
if they go in and call Cover California generally has the willingness to help, and I feel like they're better than the marketplace in my opinion. Like marketplace sort of,
yeah.
they're just
There's a couple of agents reps on the Covered California broker side that when they answer the phone, I'm like, oh yes, it's you.
yes, it's you. I know that. I know.
Yes, I know
Yep.
you're gonna fix this for
Yeah.
me.
Yeah. Yep, I know them. I know them. And you know what? They know me too.
Yeah, yeah,
That's so funny. Yeah. So yeah, exactly. It's like you're the one that's gonna be straight to the point and then like great, like I want to say bedside manners, what do you call it? Just a good energy about them.
mhm,
And they're like, willingness to help is like through the roof.
right.
So
Something I learned. it's kind of like a notion that the way I was when I was at Disney, if guests came up to me and they were, they were nice and polite, I did whatever I could for them. If they came up to me and they were like on a warpath, sorry, this is the rule. Like, so when I'm calling into the agent support center for covered California, it's just, thank you so much. Here's what I need done. And I'm like, and then they're in a good mood because you're in a good mood. And then
Right.
they end up thanking you for being polite. And so I'm like, yeah, but you're helping me. So, I'm frustrated, but I can't take it on you because it's not your fault. So please help in some way.
Yeah.
So,
Reciprocation when talking to the to cover California reps goes a
mhm,
long way. That's why they remember me, and that's why they're like,
yeah,
you've been cool since, ever since way back when." So,
yeah.
yeah, it really goes a long way when you talk to them. Just make sure that you're not like, "Dude, like, get this done for me." Like, is there they all talk, by the way. It's not,
Oh yeah.
I don't think it's that big of a call
You
center.
don't want your name on a dartboard
Right,
somewhere.
on the dartboard, exactly. They actually do, I think, have one, like,
Oh yeah.
seriously, like, for real, for real. So, you don't wanna be there. Speaking of which, we totally just, you said something, and then we totally just jumped over that. Help on demand, okay? So,
Hmm.
let's talk about help on demand. Help on demand is, a free, I would say, lead source that, when people opt
Hot
in
lead
to
source.
a hot one. So when people go
Yeah.
into the actual coveredca.com website, and then they ask to speak to an enrollment counselor or like an enroller or whatever, or if they
Mhm.
needed to speak with an agent, there's a quick button there. They click on that, and these are people who are like, I needed this yesterday, right?
Yeah.
These are people that really need coverage, and so they call in. The only catch is you have to answer in what, like, 3 minutes,
8 minutes.
8 minutes.
8 minutes. You
Um,
you need to accept it in 8 minutes. And you need to call the person within 15 minutes after
minutes.
accepting it. Yeah.
Yeah. But here's the deal, if you accept it and if you so confession time, I got kicked off of Health on Demand. So I got kicked off, here's the reason why, because I there's a score. There's a
Yeah,
score.
you weren't updating your leads, were you?
I wasn't updating my leads, and my broker rep was like, "Dude, Andrew, come on, man, come on," or my Cover California rep, and so I wasn't doing that, and I started doing that, but I just wasn't, I have other lead sources, before, like when I was like starting off, Help on Demand was clutch for me, right? But now I have Facebook ads running, now I have referrals, now I have, all these, in person lead sources that I don't know, I don't really need it per se, but it's good to have, obviously, and I do sort of miss it because of how high the intent of the leads were.
Yeah.
Um, George, I don't know how you qualify for this, and I just want to get this information out to people that need leads that are starting off and wanting to get leads. But the way I did it was, I told them that I was going to help the Korean community, and I really tripled down on that, right?
Uh-huh.
And they said, okay, that's good. Let's do it. Then what'll happen is you get a login, you do a little, was there a test? I think that was, no,
There is a lesson that you have to
lesson.
do.
There you go.
Yeah. Yeah.
And you go in and then yeah, you get free leads. You get like one every 2 days, right? Or like during open enrollment, like one or two a day.
Yeah. So since January 31st, so in the last week, I have 8 new clients.
There you go. You know what I'm saying?
Yeah.
So and
Um,
that's just free. And how did you qualify for that, by the way? Just for the people that aren't ethnic.
um, I a really good friend of mine um called in a favor.
Okay, cool.
So because I had
That
applied for it on my own, and a year into it I wasn't accepted, and the friend called in a favor to her area rep, and within like a day I had access. um Covered California help on demand is very different compared to healthcare.gov help on demand.
okay.
Healthcare.gov help on demand accepts any agent that wants to do it, and so
There's no
it's
lead.
it's inundated with agents. With Covered California, they are very picky.
They're very picky.
I did get kicked off once, and I went for mercy. I'm like, I got everything cleaned up. I went back, and I'm like, here, it's all done. Um, but yeah, they hold you to, you have to accept it within 8 minutes. You have to call within 15 minutes. You have to update the referral status in a timely manner. Um, and so yeah, they they monitor it and they hold you to it because they want the good agents for it. Funny enough, I have built my Hawaii book of business because of Help on Demand, because of healthcare.gov. Somehow I'm the closest agent in the middle of California to Hawaii that's available. Don't know how, but I have probably have picked up 30 Hawaiian clients in the last like 3 years. So I'll take it.
Yeah. No. Yeah, help on the yeah, you're so right. It's so saturated with healthcare.gov, but they're so picky with um that reminds me, I'm gonna my year's up, so I can go back and reapply.
Yeah.
That just reminded me, so thank you. So yeah, I might as well do that and get it to my admins or my other LOAs. And it's good training. It's lay down leads essentially.
Yeah.
Um Okay. So okay, good deal. So we talked a little bit. They're also called Big Wave. If you guys hear Big Wave, help on demand, they're interchangeable.
Mhm.
Okay, gotcha. So let's talk about some tips on how we can make the application process easier for people who are just like, I hate this application. This application is antiquated. This application is just so long. Why are they asking so many questions? So George, I'll have you start. What are some shortcut tips that you have for agents out there?
Um, get all the information up front. So I have an intake form that I have that I gather all the information first, and then I go through the app. Um, if a simple app for an individual, even a married couple, you can do the Cover California app in 8 minutes. It does not take a lot of time. I like it. I like the Covered California versus like Health Sherpa and healthcare.gov. To me, it's easy. I can blow through it. Um, when you log into Covered California into the broker side, I start out with a delegation tool. Um, one, because a person cannot have more than one CalHERS case number in their entire life.
Where you get flagged?
So yeah, downside about Covered California is they will let you get through the entire application, and then at the review will tell you if they're in the system or not. It's like, why can't you tell us that at the beginning when you put in their social security number?
Mhm.
So I do the delegation tool. It's first name, last name, date of birth, social security number, and then there is the consent stipulations. So if you're on a recorded line, you're literally reading them the consent that you'll be their agent of record. They're giving you permission to sign the application. They're giving you permission to take the application and to enroll them. Um, and so it's all done. If they don't have a case file already active, doesn't matter. You already have that consent, so then you go right into taking the application to go there. And it's, if you're on a recorded line, you've got proof for it, so you're good to go. Plus, it also saves you from having to do an application to find out that they already have a case number. Then you
Yeah.
have to go back and do the delegation anyway. So there's no way around it. If you try overwriting it, there are a few times when overwriting it is acceptable, but 9 times out of 10, if you overwrite it and create a new case, if the county finds out, they're going to go in and they're going to deactivate that case you just did and
Mhm.
reactivate the old one. So you might as well just do it right the first time.
Yeah, and they do flag you. I mean, the reps. I mean, they do like know who's doing that, and they're not gonna come at you, but just know that they're watching.
Yeah,
Um,
you'll get spoken to.
for sure. So yeah, even so. I had something I was gonna expand on there, but yeah. So if you're doing the delegation tool, I mean, we just talked about Hell Sherpa. I mean, it's not the same type of delegation tool with Health Sherpa. Like, there's that mess out there with ACA agents just changing each other's, changing a client's plan over
Yeah.
with just data, essentially, their birthday, their name, and the state, and,
Hmm.
like you're just in, and then you could just like change yourself as an agent of record. This is not the case with Cover California. This
No.
is my argument with people who are like, there's no money in Cover California, blah blah blah. How's this? Let's just do the math on this, okay? How's this sound? You have, let's say you have 100 ACA clients out there, right? And about 25% is going to get snatched. That's just going to
Mhm.
be, let's say, law of average, if not more, right? But then, of course, commissions may be a little bit higher. Not to say that Cover California doesn't have high paying commission. There's some certain carriers, Sharp, LA Care, Molina, there's going to be some carriers that are pretty comparable to someone in Mississippi or something, like whatever
Mhm.
the case is. But once you get into the Cover California delegation tool, they ask for their their socials. If you have that on handy, if they're comfortable within the first couple of minutes of like talking, if
Yeah.
you want to, if they give you your social, then you can just look up the social. Or there is, what I generally do is I just put their cell phone in there and I just look up the plan with their cell phone number, and then of course do all the four attestations, and then
Mhm.
they get sent over the authentication code to make you the agent of record, which Health Sherpa does not do that.
Yeah.
I
Yeah.
feel like a lot of these problems with ACA marketplace, Health Sherpa applications would be solved by just that authentication code that we have.
Yeah.
You know what I mean? It's just
Mhm.
like, come on, like, it's such an easy fix, and now we're on the phone with them, and they have verbally told us the authentication code, and
Right.
then now it's like a legitimate, I'm your agent of record,
Yeah.
right? So, I think we're doing that pretty carefully, but what I was trying to say is if somebody's losing 25 clients, at the very least, we are still the agent of record, and then if it's that hard to switch over the agent of record to somebody else, we
Mhm.
have more, like, I've lost, like, 8 clients in my career.
Yeah. It's not as prevalent in California as it is in the healthcare.gov states.
That's what I'm saying. So
Yeah.
it's like if you really did a math, you lost all that business and we get lower commission, but we can keep the business.
Mhm.
Let's just sort of like go in and audit your book and see like what's making you more money.
Yeah.
Let's just think about that. So again, if you're complaining about no money in Cover California compared to ACA, just go ahead and do some research on that. You'll be
Mhm.
surprised. Cool. I guess one shortcut tip, I think you taught me this, is I like to go to www.coverca.com and just go to sign in from there instead of like a bookmark of the
Mhm.
actual enrollment page because it takes forever. There's like certain like shortcuts to get to a application or get to a page faster. Um,
Mhm.
and I think you're like pretty good at that. So so I know that shortcut where you go just directly to the login page, the Cover California page, and then sign in, and then go from there instead of already having that saved. But you
Yeah.
have any other shortcut tips? Um,
Like, have a good intake form so that you have all of that info readily available. Um, some of the optional questions I skip. If it's optional, it's optional. I
yeah,
mean, I know we're probably supposed to be filling it out, and they would prefer that we fill it out because they're demographic questions. But if it's optional,
time is money.
yeah,
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 that's what I tell, I mean, it is just what it is. If it's optional, there's no need to list a race. It's not gonna, like mess up your subsidies if you're Asian.
yeah.
It's like,
Something else on the application when it comes to income, I always do it as the lowest possible source. So if it's an hourly income, I put it in as an hourly income. I don't do what their annual is because if for some reason the job changes in the middle of the year, then the calculations get messed up sometimes.
right,
So I rather just do it, they're an hourly employee, they're getting this, or if they're a salary employee, they get it every 2 weeks. And then you have to explain to them, are you every 2 weeks or are you twice a month?
yeah,
Um, a lot of times they don't understand the difference. It's
no,
like, are there 2 months of the year where you get three checks? They're
yeah.
like, yes. I said, then you're every other week. You're not twice a month. They're like, but I'm like, trust me. Like,
Yeah, what are you projecting? Just
yeah,
give me the projection for the year. And also in the attestation form, when they're asking for proof of income, we're putting in the annual.
yeah, yeah.
We're not putting in the monthly. We're not putting in the weekly,
Mm.
So that's another good tip there.
I fill those out for them. I put the name, the case number, the annual income. I print it out. I send it to them. I send it to them with a self-addressed envelope. They send it back to me. Or I tell them, you can take a picture of it, text it to me, just print it and sign it. We're good to go. Let
But
me do it for you because I'll get it in the right spot.
yeah.
So,
Yeah, I'm a little bit different, I guess. I have my admin sent out. So just send out the case number and then the income that was on the application.
mm,
Sometimes I'll do a jot form with, not jot form, but I'll do a form with Zoho sign. I'll send that out and
okay.
just puts it in there for them. But it's generally if you just go in and everybody has this on the PDF, they can just fill it in and then just put in their generic signature if they most people have printers, and then just take a picture and send it back to me. But yeah, and then we upload that for them, and then that's that, right? You
Yeah,
don't need to, look up their pay stubs from before or their taxes, because again, last year's taxes are not going to be the same as this year's taxes.
no.
So
And we're always looking forward. Well, I made this much in 2023. I don't care. What are you looking at for 2024?
yeah, aren't you injured right now? Aren't you? And you just say you just got married and you have joint income now. Like so many changes, right?
Yeah, yeah,
Okay, cool. So we already talked about carriers, new carriers in, new carriers out. So again, more opportunities with carriers. I wanted to get into cross-selling. This is going to be a little bit more my type of or my topic, but with cross-selling, obviously, guys, if you're not bundling with Cover California, I mean, it's just again, if you're complaining about commissions, why not add more value to your plan? Again, I consider myself a Cadillac agency, right? I mean, again, if you really think about it, if you're going to an employer coverage, then you get not only major medical, you get the Delta dental, and then you get an Aflac plan, right? That people are set up to knowing that kind of process, like when it's going to be, the supplemental that takes care of hospitalization. HR does like a pretty whatever job of explaining it, but they get it, right?
mm,
So since they already have that mentality, no, I just lost my job, it's a very easy transition to sort of replicate that. And there's other carriers out there that actually do a better job than Aflac. Funny enough, I have agents that are switching people over from Aflac to, X carrier that I deal with. And that's just all they're doing right now because the benefits, there's less rules, there's, the benefits are better, so I mean, if you guys are not cross-selling with Covered California, then it's money left on the table, really. It's
yeah.
the vision, or sorry, dental vision and hearing alone has pretty good. I never really quote anything on the Covered California dental.
I was gonna say
Yeah,
he's not talking about the covered California health or the
no,
covered California dental
no.
outside of covered California. Yeah,
That's right. Just because the coverage is better, if you just lay down the actual numbers, because that's really what it comes down to, and then the networks is, it's an indemnity or PPO, whatever. Doctors just want a PPO. But I mean, if you're really breaking down, okay, this is 1,500 on Cover California, and it's only 50% coverage for just whatever Delta Dental, whatever it is. It's not crap compared to $5,000, $0 deductible. Um, $5,000 out of pocket maximum implant coverage. Like it's nothing compared to the plan that I'm actually suggesting that they get. And
yeah,
also, dental's not subsidized, guys. So if you go to the dental section, you're not going to see subsidies. So
yeah,
why go with something that's not subsidized, or why go with something that's not subsidized for less coverage when you can go with the unsubsidized, dental plan somewhere else for better coverage? Just logic, right?
yeah. Exactly.
Yeah. So I would always recommend, at the very least, introducing that. Of course, I tell cancer statistics. Are you a heart attack, stroke kind of family? Are you a cancer family? And then, of course, I'll give you an answer on that. And then from there, you can add on an accident policy to help cover their out-of-pocket maximum. If their out-of-pocket maximum is 9,100, then guess what? This accident plan will cover you for $10,000. This cancer policy will cover you for $20,000, and that's probably like another 30-40 bucks, but that does a world of wonder for somebody that isn't making that much income, right? And
Mhm.
it's not that much money. That's a little more than $1 a day, if you did it just like a $30 plan, then it's $1 a day, right? So it doesn't break the bank, right? So obviously, guys, please cross sell. And yeah, again, we're just trying to dispel the myth that there's no money in Cover California.
Right? Oh no, there definitely is. Covered California is probably of my book of business, it's going to be probably 85, 90%.
Yeah,
So, and it's, I don't do anything else. I don't have a side gig. I'm strictly that, and I'm doing very well. So,
yeah, no, you are. That's why you're on. So yeah, I mean, guys, hopefully this all helped, and I know that a lot of you guys are gonna have questions on this. If you guys do, feel free to comment below, and please like the video. I mean, I definitely want to get more people more on and more active and engaged because we want to hit topics about California. We're a very unique state. We have so many other things going on with like whatever the case is with PNC, with, our state-based exchange on under 65, our Medicare's different, you know. So a lot of moving parts of California. So again, guys, please like and subscribe this. But George, any last words for our people out there?
if you have questions, ask us. We're here. I mean, I help agents all the time. I'm
Yeah,
not
you
looking for a
do.
downline. I'll answer questions. I might not be able to answer it instantly, but if I can, give me a day or two to answer, I'll do my best. So,
Yeah, I mean, George, man, you hopped on Zooms with me. Here's how you do things.
mhm.
Weekend sometimes too, so I appreciate that. And yeah, you're good people, man. So I definitely wanted to have you on. So guys, again, hopefully that helped out. Again, please like and subscribe on the channels, and we'll put out some more content for you guys. And maybe we might do this again, George.
Yeah, sounds good.
All right. Thanks, guys.
Mhm.